Live from ABC News Center Kitchener, Ontario, Canada, North America. This is ABC News Patrol.
Good morning, Kitchener. This is Elizabeth Labrador, your news anchor. RNO, also known as Mrs. B, is a 39 female Orthodox Christian who migrated to Canada from Ukraine last January 2023. She moved together with her 3 children and 62-year-old mother-in-law to flee from war through the Canada-Ukraine Authorization for Emergency Travel. She is married, but her husband remained in Ukraine to fight as a soldier. She used to work as a grade school English teacher. Her children are aged 9, 6, and 3. As a newcomer, she is constantly worried about her finances, especially since the 6-month-long financial aid for refugees from the government has ended. Her previous savings were just decent enough to move her family to Toronto. Samela, what is now the update for Mrs. B?
Thank you, Elizabeth. Mrs. B had an underlying condition of asthma and was taking salbutamol and fluticasone as maintenance buffers. As refugees, she and her family are eligible for OHIP, but she pays for her medications out of pocket because she does not have an extended health insurance plan. She has a maternal history of dyslipidemia and a paternal history of myocardial infarction. She had no previous surgeries and no health risk behaviors. Lifestyle-wise, she does not exercise, and her diet mainly comprises of processed food due to her limited income. Visiting parks with her family is her only recreational activity. Her recent blood work showed high cholesterol levels, so she was newly diagnosed with dyslipidemia and then prescribed rosuvastatin. She also takes pantoprazole for a stress ulcer triggered by occupational stress. Back to you, Lisa.
Thank you, Samela. When we come back, let's find out on what is Mrs. B's current employment status, her job, and daily expenses. Stay tuned after a short break.
This portion is brought to you by Conestoga Recreational Center.
Welcome back to ABC News Patrol. Jennifer, how is Mrs. B doing?
Thank you, Lisa. This is a sample breakdown of expenses of Mrs. B with her children. Mrs. B now works 2 part-time jobs. She is paid $15 and $50 per hour as a McDonald's crew member and a cashier at Walmart. She works a total of 44 hours weekly and earns a monthly pay of $2,730, which leaves her with a net pay of $2,040. Her low-income status made her eligible for monthly government benefits, accounting for $1,910 from 2 childcare benefits and $100 from Ontario benefits. Her total monthly income is $4,050. Mrs. B can only afford a 2-bedroom apartment in the metropolitan area, wherein she pays $2,650 monthly for rent, including utilities. The family's monthly food expenditure is $1,000. Her monthly medication expense costs $45 for the PPI and sleeping pills, and another $75 for the MDI inhalers. She sent $100 for her husband at home and faithfully gives $100 as a church offering. Other expenses like transportation, phone, and miscellaneous expenses account for a monthly sum of $85. She spends a total of $4,075 for all their monthly expenses, which is $25 above her income. Back to you, Lisa.
Thank you, Jen. Recently, Mrs. B did not refill her inhalers as she was short of funds. She prioritized purchasing her PPI because she needed pain relief. She also got her statins because she fears dying from heart attack just like her father. And she did not want to orphan her children at a young age. So she decided to delay purchasing her inhalers since she felt okay and never had a bad asthma attack. She thought she would be fine until her next paycheck. Unfortunately, she had a severe asthma episode at work. Since she did not have her rescue inhalers, she was admitted to the hospital for bronchial asthma in acute exacerbation. She has been discharged after 5 days of hospital treatment. Adrian, why is income and income distributions are major social determinants of health impacting Mrs. B?
Lisa was lacks adequate income because her previous work experience as a school teacher requires certification in Ontario. This limits her to working in low-wage positions. Moreover, she is the sole breadwinner for a big family. Meanwhile, living in a metropolitan area with a high cost of living dramatically impacts the daily expenses. This would demand that she earn more income or spend less on other expenses. In her case, her health was put at risk because of a poor health decision to delay refilling her rescue inhalers because of financial constraints. Therefore, Mrs. B could benefit from various health promotion strategies.
Thank you, Adrian. When we come back, let us discuss on what are the health promotion strategies that we can address to Mrs. B's current life status.
This portion is brought to you by Conestoga Importance. Considering the financial and health challenges that Mrs. B faces as a newcomer here in Canada, the health promotion strategies that apply to her situation are advocacy, health education together with self-help or mutual aid, and intersectoral collaboration. These strategies aim to educate, empower, and gain access to the available resources to address her financial needs and manage her disease. These are the following key health promotion strategies for Mrs. B. Advocacy to address Mrs. B's financial burden on drug prescriptions. Health education and self-help mutual aid to empower Mrs. B to gain control of her overall health. Intersectoral collaboration to provide Mrs. B with health support and career advancement funding. James, what is now the latest of Mrs. B's financial burden and drug prescription?
Thank you, Arvin. Advocating for access to affordable or free medications is crucial for refugees like Mrs. B, who face financial difficulties as low-income earners. The World Health Organization defines advocacy as efforts to gain support for health goals through political, policy, and social means, targeting to address health inequities and reduce disparities. Nurses, as advocates, can act to ensure that Mrs. B can access the medication she needs to manage her health conditions effectively. Our research has revealed that the Government of Ontario has a drug coverage platforms like Trillium Drug Program, which helps Ontarians and refugees pay for their high prescription drug costs. This program could assist the expenses of Mrs. B's essential medications such as inhalers, PPIs, and statins. Advising Mrs. B to apply for Trillium Drug Program could help ensure consistent access to her medications by alleviating her financial burden on drug expenses. This approach can promote medication compliance to manage her illness effectively by addressing income and distribution as social determinants of health. It is essential to advocate for the extension and improvement of such programs to ensure that they effectively reach and serve individuals like Mrs. B. Advocacy efforts should focus on raising awareness about these programs, simplifying the application process, and addressing any barriers to access. Additionally, advocating for increased funding and resources for these programs can help ensure their sustainability and effectiveness in supporting individuals' health needs. Overall, advocacy efforts should continue to prioritize expanding and enhancing programs like these support individuals like Mrs. B in accessing the medications they need to lead healthy and fulfilling lives. Thank you. Back to you, Arvin.
Thank you, James. Now, Adrian, what do you think are the health education and self-help or mutual aid to empower Mrs. B to gain control of her overall health?
Thank you, Arvin. Educational initiatives can enable Mrs. B to comply with medications and promote healthy eating habits and physical activity. The Ottawa Charter emphasizes empowering individuals through health education and personal skills development, allowing them to make informed choices and take control of their well-being. Health education and medication compliance is essential in managing illness and improving the health of an individual. For example, reinforcing Mrs. B's health literacy on asthma and the importance of compliance with inhalers can prevent complications of disease and avoid the occurrence of hospitalization. Furthermore, there are various programs and resources provided by Ottawa Public Health related to healthy eating, including community food advisor programs and healthy eating programs. Providing these resources to Mrs. B can supply her with valuable information, support, and practical tips to improve her family's nutrition and food choices. In addition, the City of Toronto offers personal health promotional skills, particularly the Caring Connection training provided by the Times Change Women's Employment Service Incorporated. This program can equip Mrs. B with the knowledge and skills to make healthier lifestyle choices, including strategies for incorporating physical activity into her daily routine and managing stress effectively. By accessing these resources and participating in educational initiatives, Mrs. B can enhance her ability to promote healthy behaviors within herself and her family. According to Potter, people needed to be assisted in managing and coping with chronic conditions so that they might live meaningful and productive lives. Thus, empowering Mrs. B with the knowledge and skills to make informed decisions on medication compliance, nutrition, physical activity, and overall well-being is vital for improving her and her family's health outcomes. Back to you, Arvin.
Before we will tackle about intersectoral collaboration to provide Mrs. B with health support and career advancement funding, the EPIN Level 4 students will end their EPIN program this coming April 19. So let us find out what other preparation or if we could have any party. Let's find out for some EPIN Level 4 students.
Hi ma'am, graduation is fast approaching. So how do you feel? Are you excited?
Yeah, I feel excited at the same time. I feel sad because I will be meeting my friends.
Oh yeah.
Yeah.
So do you have any party? What are you planning?
Oh, I'm not sure, but our classmates are planning to have a party. I think on April 18th.
Oh really?
Yeah. So,
I don't know. We're counting. Okay, back to your V.
Wow, that is great idea. Good luck guys. Good luck to the level 4 EPIN students. Samela, what's the latest?
Thanks, Arvin. Collaboration with healthcare organizations and government agencies with programs that provide subsidized or free services is essential. According to Raphael, poverty exerts its effect on health through lack of material resources that support health, through higher levels of psychosocial stress, and through health-threatening behaviors to cope with limited resources and stress. For these reasons, connecting Mrs. B with organizations or agencies with suitable programs for her circumstances can assist her in addressing such issues. An example of an agency that could support Mrs. B is the Access Alliance Multicultural Health and Community Services, which offers different programs, services, and support, particularly for immigrants and refugees who are new to Toronto. Working with agencies like this can provide Mrs. B assistance to create a healthier environment for herself and for her loved ones. Moreover, another consideration affecting Mrs. B is her health is her reduced income due to limited career opportunities. Collaborating with Better Jobs Ontario can facilitate Mrs. B with skills training for marketable jobs, financial assistance, and additional funding. Scholastic advancement will give her a better opportunity to increase her income capacity. Appropriate education consultation and access for free or funded education and training can allow her to pursue her former profession or aspire for a different career with in-demand work opportunities. Overall, connecting with various societal sectors that can assist Mrs. B in achieving better health outcomes can be done through intersectoral collaboration. This can help her address her health-related concerns and low-wage issues through the partnerships, income, and income distribution as social determinants of health can be resolved so better conditions can be developed for Mrs. B and her family.
Thank you, Somela.
These are news for today.
In behalf of our correspondents, James Antonio, Adriana Mistoso, Samela Somoshiara, and Jennifer De Los Santos, this is Arvin Bicana.
And I am Elizabeth Labrador.
And this is ABC News Patrol.